Welcome, tumblers, to another episode of the Urban Tumbleweed Podcast. I'm your host, Emily Adams, and today we have a truly special guest joining us. Someone whose expertise lies at the intersection of healthcare and environmental consciousness. Also, you might have noticed I called you all tumblers today, and that is thanks to you all for voting on your favorite, quote-unquote, group listener name. I posted a poll on Spotify and my Instagram, so thank you all for participating in that. But anyways, back to the good stuff that you're all here for. Our guest today is a compassionate medical professional who's found a really unique way to blend her expertise in anesthesia with a commitment to sustainability. Joining us in the studio or Zoom session is Dr. Liz Hansen, a pediatric anesthesiologist and assistant professor of pain medicine with the University of Washington. She is here to shed light on how the healthcare industry can play a crucial role in building a sustainable future. We often think about reducing our carbon footprint in terms of transportation or energy consumption, but today we'll explore how even minor changes to our current medical practices can contribute to a healthier planet. Dr. Hansen has pioneered initiatives in her hospital to minimize anesthetic gas waste without compromising patient care, and has set up consortiums for other hospitals who are also interested in making positive environmental change. So whether you're an active participant in the medical field, a sustainability advocate, or just generally curious, stay tuned for this conversation. Awesome. Well, first, again, thank you again for coming onto the podcast. Would love to hear just a little bit about who you are, what you're interested in, what you're currently doing, what your expertise is in.
Yeah, well, thanks for having me. My name is Liz Hansen. I'm a pediatric anesthesiologist at Seattle Children's Hospital and an assistant professor in the Department of Anesthesiology and Pain Medicine at the University of Washington. So my background, I'm in the healthcare field. I did research in graduate school on the gut microbiota, and then, about six or 7 years ago, started to get really interested in sustainability and the health effects of the climate crisis on my patients. At Seattle Children's, we take care of kids, and children are actually suffering more of the consequences of the climate crisis than adults. And we're seeing, more and more in the Pacific Northwest with wildfire season. We're seeing kids having respiratory problems related to that. So it just became something that was on my mind more and more. And I started to learn more about it and connect with folks doing work in this area. And then it became my academic focus and really my passion.
That's awesome. And that kind of leads to another question of why do you think children are more impacted by it? Is it just because the immune system is not as well established, or are there other factors that you think lead into why children are more affected by what's going on with the world?
Yeah, I mean, that's a great question. I think, a lot of it has to do with just the physiology of a developing child. So, as kids are growing, they are, like you said, they're more vulnerable, they're less developed in some ways. And so as they're growing, they need, a healthy environment, clean air, clean water. All of that is super, super important for them to grow in a healthy way. We know that when kids get sick with a respiratory infection, they have a harder time because their airways are smaller. And so just to clear out, there's secretions that we all get when we have a cold, but it's harder for younger and smaller kids. There's actually a big area of research that I'm not particularly directly involved in, but looking at how kids, are more impacted by the climate crisis, changes even in things like, vector ecology, because there are more mosquitoes in different areas than there used to be because of global warming. So there's, all these things that are connected. But there are people who are looking even at some of those surgical problems that babies can have, and they're increased in areas where there's more pollution. So, I don't know that we totally understand why all of that's happening, but we do know that kids are more vulnerable, and in areas where there's more pollution, in areas where we're seeing, like here, more wildfire smoke, and all over the world, really, where there's more potentially food insecurity, forced migration from climate crisis. And these things are affecting kids much more just because they're smaller, they're more vulnerable to those kinds of things.
Absolutely. So it's clear to see where your expertise and your passion for this intersection come in, but I think a hard thing to wrap your head around if you're not involved in either sustainability or anesthesiology or just in the medical field in general is how do you define sustainability within the context of anesthesiology? And what aspects of your research that does it specifically address?
Yeah, so that's a great question. It's not something that I really understood when I was in training at all. It's not something that was part of my medical education. But like I said, when I became more interested and kind of worried, frankly, about climate crisis, 6 or 7 years ago, it coincided with when I was having my own children. And,
Yeah.
just reading the news, seeing these reports about climate change and the impacts that it's having on human health already, and just kind of the bleak future that we face if we don't take dramatic action now, it was keeping me up at night. And so I was fortunate enough to meet with the sustainability manager at Seattle Children's Hospital, Colleen Grohl, who is a nurse, and she has expertise in sustainability. And she had been doing amazing work for years at Seattle Children's around kind of reducing the environmental impact of our healthcare delivery there. So I met with her, and she showed me some of the work that she had done, including an inventory of emissions for our hospital, which she did every year using Practice Green Health Metrics. So that's an organization that provides a lot of materials for folks to do that kind of work. And so basically, she was adding up all the emissions from healthcare delivery at our hospital. And I was looking at this pie chart that she showed me of all of the emissions, and I saw anesthesia gas as one of the slices of this pie chart. And I was like, wait, what is going on? So it was 7% of our total hospital emissions were coming from the inhaled anesthetic gases that I was using every day to take care of my patients. And so what she helped me understand was that these gases are actually potent greenhouse gases. They are not captured after we use them. They're not metabolized in a significant way by our patients. So we give them to our patients to induce general anesthesia so that they can have surgery and procedures safely. And they breathe them back out, and they go right out the roof of the hospital into the environment, where they may persist for years and years. And one of the ones that we use really commonly, especially in pediatrics, is nitrous oxide, which I think most people are familiar with and may have even been offered at the dentist to, facilitate their dental procedures. It persists in the environment for over 100 years. So it's in the environment, warming the planet and depleting the ozone layer. So they're, depending on which gas it is, they have different what are called global warming potentials. So that's a way of comparing greenhouse gases to the baseline of carbon dioxide, which we all know is kind of the big greenhouse gas. So the inhaled anesthetics that we use can have a global warming potential. The worst one is called desflurane, and its global warming potential is over 2,500 times that of carbon dioxide when normalized over a 100-year time horizon. So that's GWP 100. So she explained all this to me. I started reading the literature and seeing the work of people like Jody Sherman at Yale, Forbes McGain in Australia, Brian Cheeseborough, others who've been working on this for years and doing the research to really show, these gases can be really harmful, and we have to use them more responsibly. So once I started learning more about that, I started working with Colleen at the hospital to do education within our department. And became really, really involved in how we could use these more efficiently, more safely, so that we can still take great care of our patients and make sure that they're safe and asleep and comfortable during their surgeries and procedures, but with less harm to the environment. So that's the work that I've been focusing on for the last 5-6 years at Seattle Children's Hospital, and we have made tremendous progress, and I couldn't be prouder of our team there. The anesthesia group has really embraced this work and our mission of providing excellent care to our patients, but also being good stewards of the environment. So we have actually reduced those emissions from our inhaled anesthetic gases by over 9-fold with various efforts that I can tell you more about.
Yeah. No, I think that actually like kind of leads into my question of like, what do those efforts look like? Because if there hadn't been anything prior, then obviously something must have been done in order for that to improve by 9-fold. And just as an additional note, I feel like it would make sense in every aspect to do whatever you are doing now because it's one, beneficial for the environment, two, you're still taking good care of your patients, and three, if it's more efficient, then even from a business standpoint, that's great for Seattle Children's or whatever other hospitals or medical institutions utilize this practice or this mindset. So it feels like it's a win-win-win situation across the board.
Yeah, it absolutely is. And it's been really, really rewarding to see, just how proud the team is of the progress that we've made. And then also, yeah, the hospital is saving money. We're being less wasteful with these agents. And so we've actually reduced cost associated with these inhaled anesthetics by about $150,000 a year by being more efficient with them. And actually, we removed the worst one, that desflurane, which was actually also the most expensive. We just took it off our formulary. We decided as a group that we don't need it. We can use all our alternatives, and so it's off our formulary, and we're no longer even buying it. So it's great. And Seattle Children's, I don't know if you know this, it has been a leader in sustainability for a long time. Just the fact that we had a sustainability manager when I started there as faculty. And then now we have a sustainability director and several members of the sustainability team that are working on really a lot of areas in the hospital to reduce emissions and provide more environmentally friendly care. Because our board and our CEO have made a pledge to provide carbon neutral care by 2025. So we've got 1 year left to achieve that.
Oh, wow. Yeah.
But we've been a leader for a long time, and we continue to really lead. I think, nationally in this, and making such ambitious goals and working really hard to get there.
That's a huge bragging right for Seattle Children's. That's incredible. I did not know that at all. So now I do, and so does everyone else listening. That's awesome. And to go to what you were saying with how are you making these improvements and like being innovative in this field in order to reduce costs, to reduce the greenhouse gas emissions? What are you doing? And what did the risk analysis look like for transitioning from practice that is tried and true to what you are doing now?
Yeah, so that's a great question. And a lot of the legwork had been done when I started this by folks that I mentioned, especially like Jody Sherman published now about 14 years ago, a life cycle assessment of the inhaled anesthetics. And so what that means is her and her team looked at the costs and the environmental costs of producing, transporting, using, and disposing of each of these agents over the entire life cycle of their use. So from what's called cradle to grave analysis here. And so you can really get then a full sense of which one of these agents is going to be better for the environment, which one of these is going to cost less, and things like that. So these are kind of standard methodologies that she then applied and her team applied to anesthetic gases. So the knowledge about the choices that we can make and which agents are preferred from an environmental perspective has been known for over a decade. In addition, there have been recommendations from professional societies, including now the ASA, the American Society for Anesthesiology, on how to be more efficient with our use of inhaled anesthetics. And so part of it is really just changing the way that anesthesiologists, nurse anesthetists deliver anesthesia to be more efficient. And it's a little technical here, but when we deliver these gases, we use an anesthesia machine with tubing and a circle system, and we're reusing some of the gases going through this circle system through a carbon dioxide absorbent. When you breathe out the carbon dioxide, we don't want you to breathe that back in, so it gets removed, but we want you to breathe back in the same anesthetic gases so that we're not wasting them. And so there are adjustments that we can make to the anesthesia machine to be more efficient, use lower fresh gas flows to kind of capture and reuse those same inhaled anesthetics for the entire duration of the case. We're not reusing them between patients. That's something that would require a different technology of capture and reprocessing and reusing, which is possible, and I think is something that, hopefully in the future will be widespread. But at this point, we have really good recommendations for how to practice more efficiently, but it's hard, especially when it's not something that you learned how to do in your training and you're comfortable and familiar with the way that you do things. And so to change that requires learning new skills and practicing and improving. And so what we did at Seattle Children's was, combination of a lot of the education part of it. So really letting people know, these are the gases, these are the global warming potentials of them. Here are the recommendations for which ones to use and which ones to avoid. And then education around this low flow delivery of anesthesia that's more efficient. And then what we did, I think that was really, really unique and special, is we captured all of that information about what people were doing and how much anesthesia gas we were using for each patient. And we provided that data feedback to the team using a software that was developed by my colleague at Seattle Children's, Dan Lowe, called Adaptix. And so this is a software that's used to track all sorts of metrics and do quality improvement work, basically taking every piece of data that's in the electronic medical record and making it really user-friendly for a clinician to then go through and say, okay, for all of our cases, our tonsillectomy patients, how are they doing? What are we doing to take care of them? What are their outcomes? All sorts of things like that. And so what I talked to him about was adding a carbon dioxide equivalent based on those global warming potentials for our anesthesia gases. So we can take the data that we get from the electronic medical record, convert it to a carbon dioxide equivalent in kilograms per minute of anesthesia time. And then we can compare across the board. Okay, for our tonsillectomies, which kids are we using more gas on and having higher emissions? Which individual clinicians are having the lowest emissions, and what are they doing differently so that we can all learn from them? Because I thought, okay, I can read these papers, I can practice these techniques. I don't know how I'm doing though. I'm getting no feedback on this. And so I wanted to know, okay, how are my emissions doing? And then I could see, oh, well, look at Leah here is doing a really great job. She's doing low flow anesthesia really, really well. Her emissions are the lowest. And also I can check and make sure her patients are still having good recovery times and their family satisfaction scores are still really high, and all of these other balancing measures to make sure that we're still taking great care of our patients. And then I go and talk to her and I say, how did you do this? Show me your technique. I can watch her do it and then continue to improve. So that was a big part of how we were successful, is getting this data feedback, looking at the data, analyzing it, learning from each other, and then, a little bit of friendly competition where people would say, okay, well, Leah got a shout out in that email note that you sent out with everybody's, linked to everybody's data. How do I get a shout out next month? And so I, go through and share some of the tips and tricks that we had learned from our best performers, so that we could all grow and learn and improve together. So using, a lot of these kind of plan, do, study, act, quality improvement methodology to apply to this specific area. So a lot of the methodologies out there is just applied to this area, I think was a little bit unique and new.
Absolutely. That's awesome. And I feel like friendly competition is always beneficial, especially when you're trying to innovate or like see improvements. So props to that. And it kind of actually leads me into another one of my questions, which is, this clearly seems to have been adopted really well by Seattle Children's. Like there's a lot of excitement, there's a lot of support around the concept of making your workflow more sustainable. Do you foresee any challenges with this methodology being adopted in other hospitals or other medical institutions, or even at UW, for example? Is there any pushback that you foresee happening?
Yeah, I mean, I think it's hard whenever you're asking people to change
Yes.
and providing, a mirror for everyone to see how they're doing. I think that folks need a really safe culture in order for that to be successful. And I think that's something, I really admire about our anesthesiology group and leadership and our hospital, that this is something that could be done in a really, very supportive way. There was never any talk of punishment or shaming around the data feedback part of things. So I think that that culture needs to be in place, and that's something that comes from the group, from the leadership. And so our group, I think, is amazing in that regard, and has just been an incredible place I trained there, and now, I'm training the next generation, and it really is such a great culture. We've gotten a lot of interest from other children's hospitals around the world. And so my co-PI, Diane Gordon at Colorado Children's, and I created a consortium of children's hospitals to do this kind of work. And so now I think we're up to 13 hospitals, and we just had a couple more that have signed up to join all around the world. So mostly in the United States, but Canada and Australia as well. So it's an international consortium. We're calling it Project Spruce Forest, and Project Spruce was the name we gave to this work at Seattle Children's. It stands for Saving Our Planet by Reducing Carbon Emissions. So we're seeing implementation of this same kind of work, the education and socialization, some practice constraints and data feedback, using this adaptive software to really, track the progress and provide that feedback to the teams. We're seeing some challenges that we didn't, experience at Seattle Children's at other places. But we're also seeing, really innovative ideas from the individual site PIs that are doing this work and leading their groups. So it's been amazing to see how each of, the site PIs, we meet every month, how we are supporting each other and learning from each other. I think, it comes back to having a culture of openness and support and being really willing to change and have folks not feel shamed. I think that is a big part of it. And so creating that culture in these different groups around the country and the world, it's challenging if it's not already really strongly in place. So that, I think, is one challenge. And I think that, there are so many metrics that now people are looking at, and there have been, unfortunately, a lot of metrics tied to, performance evaluations, reimbursement, things like that. And so I think that there is some hesitation to add more metrics. And I understand that, there's a lot to keep track of. And obviously, providing anesthesia to patients undergoing surgery is stressful, it's demanding, it's, there's risk involved, and we all want to do a great job and focus on patient safety and quality. And so, there are many, many things to worry about and aspects of that to focus on. And I would argue that environmental stewardship is quality care, and it is part of providing safe care to our patients. And so I think that that's, that integrates into all of these other quality metrics. But I don't know that everybody has that viewpoint yet. So we're still, getting there. And I think that there's a lot of whataboutism that can happen. Well, I'm using these anesthetic gases to take care of my patients, and you're driving a gas guzzler into work, or you're still flying on a plane to go to this conference or whatever. So that it's like, well, we can do all of it. And I think that what was striking to me when I first was learning about this was just the scale of impact from the anesthesia gases. And so there might be this whataboutism, but really, if we can make a change in our anesthesia practice, we can have a much bigger impact than, say, switching to an electric car or, something that's on a personal level, which I would still advocate for, I have done. But really, we can have a huge impact by moving away from these higher impact gases like desflurane, nitrous oxide, using low flow, or even there are alternatives to any of these inhaled anesthetics that are IV formulations of anesthesia medications that we can use, and a lot of times are going to be more environmentally friendly and maybe better experiences for our patients, even in some cases. So there are a lot of things that we can do. And I think that, we just need to motivate people and show them how it can be done, and learn from each other so that we can all continue to improve.
There were two big points that really stuck out to me throughout that, which is the one, don't let perfection be the enemy of good. Exactly what you said, like the whataboutisms are irrelevant in the grand scheme of things because you can whataboutism for everything all day long and you'll just stay stuck in the same spot. So I 100% agree. Any and all improvements are just that, they're improvements. So absolutely, that's awesome that you're working towards that. And something else that I thought was really interesting was the concept of environmental stewardship being a part of the healthcare process, because that feels very much so like the concept of preventative medicine as opposed to reactive medicine. And so it's really interesting to think about it in that perspective, outside of it just being its own separate entity or concept. So yeah, I just really wanted to pull those two bits out because those really, really stuck with me. And of course, addition to all the other great stuff that you just said, but like those two really hit home personally.
Yeah, I think it's been, especially as a physician who takes care of children, I
Yeah.
feel very much that this is part of my mission as a physician, as someone who takes care of kids, that I have to also take care of the environment and look out for the future planet that these kids are growing up in and will inherit from us. So it feels very much integrated into my role and my duty as a physician.
Absolutely. Absolutely agree. And you really actually touched on a lot of great points that I think people would hypothetically have concerns about regarding like what does measuring success look like when it comes to anesthesiology in terms of sustainability, or does this impact patient care? But it's very clear that throughout the process that you and your colleagues have gone through, like patient care has remained a number one priority with the goal of making it more sustainable. So it feels like there aren't really any concerns there. One of my personal questions though is when it comes to collaboration, what does that look like for you as a physician versus like who are you collaborating within the hospital? Who are you collaborating with when it comes to third party entities in order to make this work? And if hypothetically somebody else from another hospital wants to make this work, who would they possibly need to look to in order to make their mission of creating a more sustainable medical field a reality?
Yeah, that's a great question. And I feel like there are a lot of answers to that. So specifically with the anesthesia part and the inhaled anesthetics, we are happy to help. We have our, Children's Hospital Consortium, Project Spruce Forest. We've gotten some interest from adult hospitals, so we are now also creating a consortium for adult hospitals, Project Evergreen Forest. You can go to our website. You don't have to join the consortium to get, access to all the free resources that we have on the website. So it's projectspruceforest.com, or you can just probably Google it and it will come up, or whatever search engine you want.
They'll be linked in the description.
Perfect. Yeah. So, please go there. Please email me. My contact information is on there. I'm happy to help if you are an anesthesia person who wants to get involved in this work. In terms of, within the hospital, other healthcare folks, your hospital may have someone working in sustainability, like we had at Seattle Children's when I first started, Colleen Grohl, and now I have Sriti Pendlakofla, who's in that role of sustainability director, and I have other folks that I'm working with there. So really connecting with folks that are already potentially working on this where you are is a great way to start, and see what's being done, see what opportunities there are. There are a lot of resources out there. I mentioned Practice Green Health. Healthcare Without Harm is another resource, a great organization. And then within whatever specialty you may be in, there are subspecialty and specialty groups that have, formed to work on sustainability within their individual specialties. So I think there's a lot of opportunities in different areas. And then I feel like there was one other thing I was going to mention. Oh, I mean, I think, a lot of in healthcare, I'm an assistant professor at a school of medicine. I have a teaching role as well. So really educating the next generation of medical students, nursing students, all sorts of healthcare workers. I think what we will find is that generation is hungry for this knowledge. And if they're not already asking for it, they want to know. So really connecting with those students and those learners and seeing what they want to know, working together to learn what you can, creating a curriculum, even just, finding the materials online and putting together a talk. I mean, you don't have to have a project in place to share this information with the learners that may be around you. So that is one way I think that folks can get involved.
Absolutely. I couldn't agree with more with you on the educational aspect. I feel like kind of going hand in hand with what you're saying, where the children that you're taking care of are going to grow up into this world. Like, if you can also educate them to have that mindset of taking care of the planet, of incorporating sustainability into their everyday life, into their career as not a fun exception or a fun little bow to put on top of their work, but as an integral part of what they're doing, all the more impactful. So could not
I
agree with
know
you more on
we've
that.
heard this phrase, I think, a lot, but every job is a climate job.
Yes,
I really
absolutely.
believe that. You can always find something in your work.
Yes. Which actually kind of leads into one of my other questions, which is you had mentioned possibly a technological advancement of recapturing and quote unquote recycling gases, which obviously includes both medical knowledge as well as technical knowledge, as well as I'm sure a litany of other skills necessary. But are there any other advancements that you think would be really impactful in the intersection of sustainability and anesthesiology that you hope to see in the future?
Oh, that's a great question. I feel like there's already so much that we know that we're not implementing, that my focus tends to be so much more on just let's do what we already know is good and do it well. But yeah, I do think, I mean, new medications coming around the pike, that's something that's always happening. There's new medications that we could use that could maybe potentially completely replace what we're using now. So that's one area that would be amazing if we found an environmentally friendly inhaled anesthetic that could be used in an efficient and safe way that didn't have a global warming potential of, in the hundreds. That would be great. I think, some of these capture and reuse technologies are in development. I have heard from some of the reps, and I think that there's a lot of potential there. It's something that, you would have to install then on every anesthesia machine, and there's cost associated with it. So I think that will have to evolve to a point where it's something that hospitals will want to spring for to save money. I think that's a big motivator.
Yep.
And then one thing that I wanted to mention that didn't necessarily fit into previous questions, but it's sort of a technology fix. One of the things that we discovered in measuring our inhaled anesthetic use was that we had a big discrepancy between what we were using and what we were buying, particularly for nitrous oxide. So we saw a cost reduction as we were being more efficient with our use for our volatile anesthetics, those inhaled anesthetics other than nitrous oxide. But what we didn't see is a big decrease in our nitrous oxide purchasing. And the reason that is that the system, how we deliver our nitrous oxide, is from a central cryo tank, and it goes through pipes through the whole hospital. And we have all these connections and manifolds and pressure gauges. And then we have a hose that we connect to our anesthesia machine. And at every point along that system, there can be leaks, and there are leaks. And so necessary situations, and we reduced our use significantly by over 90%. We were still purchasing a lot of nitrous oxide that was being wasted in the system. And so that nitrous oxide is lost. It's going into the hospital in unclear locations where there may be patients, workers, family members who may be exposed to it in small amounts, but particularly occupational exposure over days, weeks, months, years can have negative health implications, particularly for people who may be wanting to become pregnant and carry a pregnancy to term. There's some risk of increased, miscarriage rates with chronic occupational exposure to nitrous oxide. So this is not only wasteful financially, environmentally, but it may be, something that could be causing harm to folks in our hospitals. And so at Seattle Children's, we're capping off that system. We're switching over to tanks that are at each anesthesia machine or at each delivery location that can be completely closed in between uses. So these are different from our big central cryo tanks that have a different way of regulating pressure that is more inherently leaky, to smaller tanks that can just really be closed off and virtually eliminate any of that waste that we're seeing with the central system. And so switching over to that system is going to save us money in the long run, and it's going to really reduce our waste and emissions associated with nitrous oxide, especially since we have stopped using it routinely and we aren't giving it to almost all of our patients the way we used to. We're giving it only to the patients who really need it for a good medical indication. So that's something that it's maybe a technology fix, but it's really just a systems change that needs to happen at every hospital and system that has a centrally piped nitrous oxide delivery system. This is going to be an issue. And so maybe this is a policy change that would happen in the future that would require systems to at least be looking for this leak and addressing it if it happens. But so far, every hospital that has looked at this has found the same thing. This really inefficient, wasteful system that has, some of this leak associated with it.
I'm very interested and intrigued to see what's like maybe in a couple months from now, if we hear back, like I would love to see what that improvement looks like on your end. Just like the data behind it, because it seems like it has the potential to be such a huge fix. And it just hearing about it makes me excited for what that potential could be. So I feel like we also touched on pretty much everything that I was personally very curious about. Is there anything that you would like to plug before we just kind of close out?
Oh, I just want to say thank you so much for having me on here. It was great to meet you, and thanks to your listeners for making it to the end of this topic. I know it's a little obscure for folks potentially not in the medical field, but it's so important. So thank you for talking with me about it. And and I do want to once again highlight the amazing work that our anesthesia team has done, and then the sustainability folks and the leadership at Seattle Children's have just been amazing. And I'm really, really proud to be a part of it.
I honestly, as you should be, because it sounds like they're doing really great stuff. I'm personally going to research it more, just look into what Seattle Children's is doing, because I'm now very interested as a consumer, not a patient anymore. I think I've aged out, but sounds really cool. But again, thank you so much. The links to your consortiums will be in the description below. Great. And thank you again so much for coming on and discussing this. This is, for me, really, really interesting, even though it's like a little bit of a niche intersection. So cool. And I'm sure a lot of other people think the same. So thank you again. Really appreciate your time.
Thank you. Take care.
You too. Bye.
Bye.
I hope you all found that discussion as educational and fascinating as I did. Dr. Hansen and her team at Seattle Children's are doing truly groundbreaking work that I hope will continue to positively shape the medical field in a sustainable manner. If you are interested in learning even more about Dr. Hansen's work, links to her consortiums are listed below. And if you're doing something of your own in your field of work that is pushing the needle in sustainability, let me know. I'd love to learn more about your story and highlight you for the work that you're doing. But with that, thank you again to Dr. Hansen for joining me today. Thank you all for listening to another episode, and until the next one, stay rad. Bye.